All right, hey y'all. Now we're switching gears. So remember whenever I talked about that very first lecture, whenever I just briefly said that these drugs are broken by based on what they treat instead of the systems of the body that they work on, like our previous classes. So all of the drugs that we've talked about up to this point were antibacterial drugs. They were antibiotics and they treated bacterial infections. We are now talking about drugs that treat viruses. Viruses, like bacteria, can infect any part of your body. You can have a viral eye infection. You can have shingles, which can be across your whole torso, or any part of your body, really. You can have the coronavirus, which, affects, systemically, it affects us from our lungs to our smell, all of those things. So again, these drugs are not specific to the part of the body that they affect, but by how they, by what they affect, which is viruses. So, all right. So again, just like I told y'all, we don't give an antibiotic for a viral infection. We don't give antivirals for bacterial infections. Although sometimes a bacterial infection may compromise your body and lead to a viral infection, and you might have two different things going on at once and vice versa. So viruses in general. And I posted the video that I referred to in your very first lecture, chapter 6, and I said, look at the video and the differences between viruses and bacteria. It is uploaded now under that first in the chapter 5 and 6 lectures. So you can refer back to that video for the viruses, if you just want to kind of look at them separately there. So viruses in general, we know, are not necessarily classified. They're kind of in between living and non-living things. They have to have a host cell. They have to basically take our little cells hostage in order to replicate. They are not self-dependent. They can't grow and reproduce alone. They enter the body through various routes, the same way that bacteria do oftentimes, through all those portals of entry, through your eyes, through your nose, through your mouth, through openings on your skin. So viruses attach to host cells. They release their RNA or DNA, and the viral material takes control of the host cell and forces it to replicate the virus. So antivirals in general, just like antibiotics, they work the same way in that they're specific to viruses. They combat viral infections. Because viruses must have a host to reproduce, all of their mechanism of action are there's antivirals and there's antiretrovirals, which we'll go into that. But antivirals are going to work by interfering with the virus's ability to reproduce in a cell. So they're more difficult to develop because so many of the processes necessary for viral production are the same processes that we need to go about in our daily lives. So think about think about our cells, all of our cells that are reproducing on a daily basis. If a virus must grab a hold to one of our cells in order to sustain its life, it makes it a little more complicated to kill this virus that is attached to our cell, because in turn we're going to damage the host cell that the virus is attached to. So in general, they have a little bit more. They're harder to develop because it's hard to find that difference, or not difference. It's hard to find that balance between being harmful to the virus that we're trying to eradicate and being harmful to the host cells that they're attached to. Also, viruses, of course, they are going to evolve much like bacteria. They're going to change. And a virus can infect your body and it can attach to one host cell one time and another host cell another time. And all of that changes the reproduction and changes, how that virus presents itself from your illness, I guess, is exhibited from your body. So all of those things make it more difficult to develop antiviral drugs. At the end of the day, the drugs have to be able to target specific events that happen in the viral replication cycle to be effective, and attempt to disable the protein part of the virus. So they break them apart and, get to the inside of that replication, kind of like we talked about the drugs that affect the RNA and the DNA in the bacterial part. These antiviral drugs have to interfere with that replication as well. So they are used to treat things like cytomegalovirus, genital herpes, herpes zoster, HIV, which is, y'all know, can lead to AIDS, influenza A and B, that's the flu, RSV, that's a respiratory virus that's very dangerous, especially to young children, hepatitis B and C. And then there's also going to be some unlabeled uses for antivirals. But those biggies that I just named out to you, we're going to use to antivirals. We're going to use them to treat those conditions. In general, they cause nausea, vomiting, and diarrhea, much like antibiotics do. They can cause headaches, rash, fevers, and insomnia. We don't give them to patients who, of course, are allergic to these drugs. And we're going to go into some of those specifics in a moment. So in regards, antivirals are used in pregnancy and lactation only when the benefit outweighs the risk to the fetus or the child. So, we said that they can be harmful to our body, to the cells in our body. So they can often be harmful to the fetus and, baby. So what happens is, at the end of the day, like I told y'all with everything, it's a risk-benefit thing. If this infection is going to kill mom if this virus is going to kill mom before she births baby, a lot of times we have to take those chances with those risk benefits. So no, it's a risk-benefit thing. We always use them cautiously in patients with renal impairment and history of respiratory diseases, any history of immunocompromisation. The help. I cannot, y'all know I can't talk. If they are immunocompromised. Okay, so retroviruses attack host cells just like viruses, but the RNA is the primary component of the virus instead of DNA. Retroviruses contain an enzyme called reverse transcriptase that is used to turn the RNA of the virus into DNA, helping to produce more of the virus. So antiretrovirals are they are used whenever a lot of times when we are treating AIDS, okay? And it is highly active antiretroviral therapy. They are used often in conjunction. Like one of them is not used at a time. It's a combination of these drugs. Like when we talked about TB, all of those drugs together make them effective. It's the same way with antiretrovirals. All of them together is what makes them effective, because one is affecting the protease and one is affecting the non-nucleotide non-nucleotide reverse transcriptase inhibitors. And they're all targeting those viruses at from different places and working together to ultimately eradicate that virus. So I want y'all to look on page 128, and you're going to look over here. So your antivirals are at the top. And underneath there, your subclasses, you have some that will treat cytomegalovirus. You have your anti-herpes virus agents, and then hepatitis B and C. I am going to make this afternoon for you guys a drug list with the most common of these drugs. You're not going to remember them all, but you should absolutely remember Valtrex and acyclovir. Those are drugs that you're going to see repeatedly. And then, some of the biggies that we're going to use to treat Hep B and Hep C. And then the antiretrovirals are going to be on the bottom of page 129. And the biggest thing, they're all used for HIV infection. You'll see on the list that I make out for y'all, the main thing I need y'all to understand is it's not one of these drugs or the other. It's usually about 4 to 5 of them. So if these people have to take 4 to 5 of these drugs, you have 2 things from a nursing standpoint that you're keeping in mind. You're keeping in mind the cost of these drugs. So they're on them long term, and they're not on one drug. They're on, 4, 5, 6. They're on that highly active antiretroviral therapy, that whole group of medications together. So cost is a biggie, and compliance is huge. It's just like it doesn't do good for TB to take, those medications for 3 months. It's the same way with these medications for treatment of HIV. They are not going to be effective if you're only taking 1 or 2 when you feel like it. And then, of course, they're affecting some of those other body systems. So that nausea, vomiting, diarrhea, anorexia, they're not eating, rash, all of that stuff is going to play into that non-compliance as well. So you'll see that all of these drugs end in VIR, regardless of their class. So I need you to at least pick out that if it ends in VIR, it's going to be a antiviral drug. And then we'll be working backwards from there. So antivirals treat viruses. I already told y'all that, but I just don't want y'all, that's a simple concept, but everybody wants to cross antibiotics and antivirals, and they're not the same thing. And then as far as your nursing alerts go, look a few things on here. So I already told y'all that antiretrovirals treat HBV, HIV, and AIDS. So when you're teaching your it's not on there. You just have to make sure that you're gathering that information from them appropriately. And we want to know in regards to their therapy, what is their reason? Why are they not taking it? If they're not being compliant, you need to find the root of that issue. If they're not taking it because it's making them sick, then maybe we've learned about our antiemetics. Maybe they can have an antiemetic in addition to that drug. If they're not taking it because they can't afford them, then maybe we can work on getting them a grant. But it is your job as a nurse to investigate those things so that you can be proactive and not just say, oh, they're non-compliant. We need to know why they're non-compliant with these drugs. And that is really the big stuff with antivirals. I do kind of want y'all to know, I'll put it on your little list that I'm about to make. Those big ones you have to recognize them. I'm not going to ask you to memorize every drug, every HIV drug on 4 different pages in your textbook, but some of the big ones we're going to have to really commit to memory. And that's it. And I'm actually going to add chapter 12 onto here. So chapter 12, right, so let me get this slideshow off so that y'all don't get taken back. So that was the end of chapter 11 lecture. We're now moving on to chapter 12. It is really not even a lecture because I am only pointing out like 5 things that y'all need to know from this chapter. So you need to know that when we talked about so far, when we had our little tree, or our umbrella, we talked about all of these are anti-infectives, and that those infections can be bacterial or viral. Now, the other two types of infections that they can be are fungal and parasitic. So you are not going to see drugs for parasites very, very often. A lot of those you can purchase over the counter for things like worms for your children. If you have certain things and like malaria, you'll be taking some of those medications, and I'll put them on your chart as well. But for the most part, you're not going to see a whole lot of anti-parasitic and anti-protozoal drugs in practice. So I want you to take when you're committing these drugs to memory, your antifungal drugs. Oftentimes, a fungal infection happens because those normal flora were killed when taking antibiotics, and they make your body more susceptible to fungal infections. So your immunity is already lower, and then so oftentimes fungal infections aren't just fungal infections. They're often seen in conjunction with other types of infections. So one of the common infections that you are going to, one of the common fungal infections that you are going to see, you're going to see candidiasis, which is yeast. That can be vaginal or oral. So if it is oral, you'll see patches on the tongue, white patches on the tongue. It starts out before it gets white and patchy, real raw and tender. If your patients begin complaining of that, you need to recognize it as thrush or oral candidiasis. The treatment for that is often diflucan. And so that's one of the biggies there. You also, for systemic infection, systemic fungal infections, you are going to be seeing, lost my train of thought, I'm sorry. Diflucan can be given for that as well. Ketoconazole is the one that I was looking for. You're going to see that for systemic fungal infections. You're going to see nystatin, swish and swallow, for oral candidiasis fungal infections. And you're going to see for, let's see, trying to make sure. Those are the biggies. Those are the biggest ones that y'all are going to have to pick out. Yep, I think that's it. You're going to see those most frequently. Your patients are going to be on them a whole lot. They are for fungal infections. When we're teaching about these meds, just make sure that they are knowledgeable as to why they're taking them. And I want y'all to look on page 133. There's some common vaginal antifungal drugs. Those are often found over the counter. Those are your things like Monistat for yeast infections. If your patient is repeatedly using these things and you're gathering information from them, then remember we talked about diabetes, and we talked about some of those things that are going to make them more prone to yeast infections and more prone to things like that. Even though they're over the counter, we need to be aware if it is something that is taking place over and over, and we need to find those trends so that we can kind of get to the root of those issues. Isn't just a matter of education, of urinating after intercourse. Whatever is going on, education is very, very important. Same way with your anti-protozoals and your anti-helminthic. Of course, worms are not always associated with poor hygiene, but sometimes they are. Sometimes, children, they're digging in the dirt, which you can't avoid that, and they're chewing on their fingernails and different things like that. So sometimes it's a matter of education, and sometimes, of course, we can't change everything. My kids have had before. I mean, you sometimes can't help that stuff, because they drink their bath water and they do all these disgusting things that kids do. But if we can educate, a lot of times we can prevent some of the need for these medications. And that is really it, y'all. That is chapter 12 in a nutshell. Let me make sure I covered it all, and then we will, that's it. but they are mostly, they have minimal adverse reactions because most of them are for superficial infections, either fungal skin infections like ringworms, or like I said, vaginal or oral fungal infections. So that's really it. Email me with questions. I hope to have the medication list out to you guys by tonight. Worst case scenario, I would say tomorrow night. But hopefully by tonight you'll have all those, and your questions will come from the, of course, all the chapters, but they'll come, your medication specifically will come from the list that I provide you with. I hope it helped a little bit last time. And that's it. Have a good day. Have a good weekend. Stay safe.